Hi guys, today I just want to talk to you about pain versus arthritis. I had a patient come and see me a number of years ago, and I looked after him for a fair while. He was in his mid-50s and had developed type 2 diabetes, which was unfortunate for him. Type 2 diabetes, there is a family history aspect to it, but the main reason people get it is because they've got too much weight. So once you put on fat or adipose tissue, your body becomes resistant to the effects of insulin, which is produced by your pancreas. And then if you continue to be overweight, eventually your pancreas runs out of steam and the sugar in your blood gets to a level where we diagnose you with type 2 diabetes, and then that has all sorts of flow-on health effects. So the key in trying to treat it is to try and lose weight, which obviously you do through diet, and regular physical movement helps regulate your blood sugars and obviously helps your cardiovascular health. So with this fellow, I gave him the advice, and he was very resistant to it, as a lot of patients are. And probably one of the biggest things for him was citing that his knees were just too sore, and so we ended up doing some x-rays of his knees, and there's no doubt that he had end-stage osteoarthritis in both knees. I mean, they were shot to pieces. So that did not change my advice to him. I did say that I still think the benefits of movement will outweigh not moving, and I suggested to him to maybe just take some simple pain relief like some paracetamol and ibuprofen, and then just make a goal to walk around the block just once, and then build on that. As the years went on, he continued to gain more weight and not follow my advice, and eventually he got to a point where he needed insulin for his diabetes, and he really did not want to inject himself. So he disappeared. He didn't come back for follow-up, and probably about 6 months later, this man walked through my door who I vaguely recognised. Had a big smile on his face, and he was a lot slimmer than the last time I'd seen him, and he told me this story where basically he's gone and taken my advice and taken some simple pain relief and done one lap around the block. And having done that, and realising that the world didn't fall apart and his knees actually held up okay, he was then inspired to do more of it. And over the past 6 months, he was very proud to tell me about how far he had walked and how that equated to going from this city to that city. And of course, once he started regularly walking, he started to feel better about himself, so he stopped comfort eating and the weight just dropped off him, and here he was, a happy man. As far as his diabetes was concerned, he no longer needed any medication, which was terrific. But here's the thing, based on his x-rays, his knees were still shot. I mean, he has end-stage arthritis. However, he no longer had any pain, none. Isn't that amazing? So this guy has x-ray evidence of end-stage osteoarthritis, but no longer has pain. And this is the point I guess I want to get across to you. So we go to physios and surgeons and doctors because we have pain. Very often nowadays, we then go and get scans done and it identifies some pathology, and then we sit there and go, this is what I've got. And very often that then leads to some form of physical therapy. It also often leads to surgery for people. Particularly if you are of a certain age, you might end up getting a joint replacement. And I wish I had $1 for every time I've had a conversation with someone who's carrying a bit of weight and saying, oh, it's my knee or my hip, but I'm going to go and get a hip replacement or a joint replacement, and then I'll be able to exercise, and then I'll be able to lose weight. You can lose weight now with no exercise. You just need to engage with the diet. And as I said in my original talk, I think intermittent fasting is a terrific form of dieting. The CSIRO diet is also a wonderful diet to look into. It doesn't cut out any foods, is very prescriptive, gives you shopping lists and recipes. So that's a good one to check out. So you can lose weight without doing any exercise, just by watching what you eat, because the vast majority of weight loss is related to diet. The other thing is, if you are going to go and get surgery because you've got significant arthritis or what have you, or you've received advice from a surgeon that you need to have it because of X, Y, Z, then if you build up the muscle around that joint, you'll then do much better in your recovery. And what you may find is that as you lift weights and walk and diet and lose weight and build up strength, that pain that you're experiencing may completely disappear, and then you may not need surgery. I've had the privilege of being inside thousands of joints. I assisted an orthopedic surgeon for 10 years, and it never ceased to amaze me where we would do a knee replacement on someone and their knee was completely destroyed. There was not a single bit of cartilage anywhere to be seen, and it was just a war zone. And that patient said, they had a bit of stiffness and pain maybe at night. And then we would do a knee replacement on someone else, and there's no doubt they were completely worn away inside their knee joint at a certain part and needed a knee replacement based upon those criteria. But that person had an incredible amount of pain. So based upon my 25 years of clinical experience and having used the example of one patient, of which I've got many other examples, if you build up the muscles around your joint and you lose weight, you might find that your pain goes away. You've still got arthritis, but you don't have pain. And I think that's a very important thing for you to understand. And remember that no matter how much difficulty you are in with your joints at the moment, you can lose weight by just looking at your diet. You don't have to have an exercise regime to drop the kilos. And if you drop the kilos, I think you'll immediately find that things will become less painful for you. Okay, but that's all I've got to say on that. Have a great day. Thanks for listening. And remember, the power to be healthy is within each of you. I can't stress this enough. Okay? Get amongst it, guys. Ciao.